Good afternoon, everyone. My name is Andrew Warburn. I'll be representing Retina Technologies tonight. And our project for this hackathon was a proactive retinopathy monitoring for at-risk sickle cell patients using machine learning. So just to give you a little bit of information about sickle cell, it's when your red blood cells aren't disc-shaped like they're supposed to be. They're in sickle form, and it affects about 100,000 people in the United States, and over 300,000 people are diagnosed worldwide. So the typical diagnosis for someone with sickle cell is you're going to look for retinopathy when these sickled blood cells can go and clot up vasculature in your eyes. And this can lead to multiple different visual deficits such as blurry vision, floaters, or unequal vision in both eyes. And so these patients need to go see an ophthalmologist, and then the ophthalmologist will further characterize their disease and treat the retinopathy. However, the problem comes with getting patients to the ophthalmologist. This is where our app comes in. There isn't a constant screening, and there's frequently a barrier to care for patients to get there to their ophthalmologist, whether it's in access to healthcare or it's simply scheduling an appointment 3 to 4 months in advance. And retinopathy can go undetected for years without proper screening and can lead to permanent blindness. So we developed an app that basically asks users to type in a word, and while they're typing in a word, we take pictures and use machine learning to use facial detection, and then based on that, we can measure the distance that they're reading the word from their phone. And then we'll build a profile for these patients, and then we'll have a physician's app where they can download or upload patients' profiles, and then they can see longitudinally the patient's progress in visual acuity over time. And if the patient's visual acuity suddenly changes, then we'll have an alert system go out to their providers. So basically, this is how the app works. We have this boundary box right here, and then we calculate the area of the boundary box, and then we build that profile based on the distance that the machine learning calculates. And then it'll sync up with the provider's app as well. And here's just a proof of concept. So you can see that the closer you get to your phone, I mean, you can see this in real life, that the closer you get to your phone, the more your face will take up the image. And so the markets that exist today in the United States, as I said earlier, there are about 100,000 people diagnosed with sickle cell retinopathy, and 30 to 40% of them will have sickle cell retinopathy. So that's a $420 million market. And in the next 7 years, globally, it's predicted to be a $5.5 billion market with more than 300,000 people diagnosed per year with sickle cell. Individual markets include the insurance companies, a lot of the large ones such as John Hancock and Cigna, who offer wearable discount programs. So this app will fall under that category to follow these patients longitudinally over time. And of course, the ophthalmologists have a vested interest in this app as well. And the time is right for this fiscal feasibility. So CMS in 2019 will be including reimbursements for their digital health monitoring, which this app falls under, and health insurance companies will soon follow suit after CMS follows. And ophthalmologists will be incentivized to use this app to reduce time in clinic to see non-high-risk patients. So the current apps that exist are really vision tests and then sickle cell crises apps, which basically are sickle cell pain apps, but there are no apps that use or predict sickle cell retinopathy, especially with machine learning. And last but not least, our future directions. We want to use this app to ultimately be passive, so you don't even see the app going, but it'll take pictures and determine the distance from your face without you having to do it, so that'll keep patients doing it all the time. And we want to have an add-on to your phone so you can take pictures of your retina every 2 months, so we can do proper screening and use retinal fractional machine learning to see if your retina is healthy.
So how would you make money for this? You mentioned some big market numbers, so how would you make money, right? And recurring over time?
Sure. So this is no cost to the patients, but this will be covered by insurance, and then we'll also have sort of a provider. The provider app is separate and will be charged either as a yearly, annual, recurring fee, and of course the hardware that comes with, if we get to the retinopathy and the retina picture and imaging, that'll come with a fee as well.
Can you explain, how does the distance from the face predict the retinopathy?
Sure. So if we go back, basically where you're reading this phone, the retinopathy comes with a bunch of different central field visual deficits, so it makes it harder for you to read. So if you're usually reading at 50 centimeters, and then you have some onset of sickle cell retinopathy where your vision's starting to get clouded or distorted, then you're going to bring your phone closer to your face. And based on that, we can use our ML and facial recognition to see that your face is closer to your screen passively, and we'll report that.
So how do you deconvolute that from other visual degeneration things like diabetes? I mean, there are a million of them. I turned 40 and all of a sudden my prescription went.
Of course,
right?
yeah. I mean, I turned like 16 and it did that too. So, yeah, and this can be used for a multiple visual degenerative diseases such as macular degeneration or cataracts or glaucoma or stuff like that. And we'll just change and tweak the algorithm a little bit to adjust for each of these, and especially with the future imaging of the retina. Any other questions? Great, thanks guys.